All right. Now you suspect you have diabetes or one of your near and dear has diabetes. And then you start scratching your head thinking, okay, how am I going to get tested for it? How do I figure out whether I'm a diabetic? Do I need to go to a lab or is it enough I do it on a glucometer? Use it on one of our shopping apps and get a fancy glucometer at home and then again scratch your head because you don't know how to use it properly. You're not sure. All right, you know how to use it. And so use it, and your blood sugar level is shown as 180, for instance. So what do? Again, you scratch your head thinking, okay, so is 180 too much? Is it fasting? Or is it postprandial, that is after food? Or is it random? Okay, you say fasting, it's not fasting. So is it postprandial or random? No idea. You're totally confused. So, what are the tests that you got to do to figure out, to diagnose that you are a diabetic? Yeah. Hello and welcome to a new episode of Diabetic Care Global. And I'm Dr. Satish Bhat, consultant diabetologist and diabetic foot surgeon. With over 15 years of experience in diabetology and the guidelines which have evolved over the last several years, we have come to a conclusion about the type of tests you need to do in order to diagnose diabetes. Of course, like with any other condition, self-diagnosis is not a good idea. So please consult your doctor. But then it's okay to know what is what. So we'll try to keep it as simple as possible. There are just three basic tests that could give you a very clear picture about your diabetic status. All right. Before that, there is a word of caution. Do you need to wait for symptoms? Symptoms like excessive thirst, excessive hunger, weight loss, tiredness. Do you need to wait for that? Never. In today's world that we live, if you are more than 25 or some guidelines say 30 years of age, I would say 25 in the high stress environment that we live in, you got to get your blood sugars checked at least once every 6 months. So what are those tests? Very simple. Fasting blood sugar, postprandial blood sugar, it's called PPBS or postprandial plasma glucose, PPPG, and HbA1c. So how do you do your fasting blood sugar? Very simple. It should be done in the morning hours. So you're not eating or drinking anything that contains calorie. So what fasting means is at least 8 to 10 hours of no caloric intake. So no caloric intake for at least 8 to 10 hours, meaning you can drink water. Okay, so you have not taken any calorie containing food stuff or drink for at least 8 hours up to a maximum of 10 hours. Not recommended to fast for more than 10 hours if you are doing your fasting blood glucose. So you fast for these 8 to 10 hours and get your sample taken in a laboratory. Yeah. So is there any difference between getting your blood sugars done in the laboratory and on the glucometer? Yes, there are certain differences about which we'll talk in a later episode. Yeah. So that's fasting plasma glucose or fasting blood sugar. Next, you have regular food at the regular time in the regular quantity. Please do not change your food intake or your food habits or even your medications on the day of getting yourself tested. Please do not change anything. If you are exercising, please exercise regularly. If you have been regularly exercising, your daily routine should be just normal. And have your regular food. From the first bite of food, wait 2 hours. At the end of 2 hours, you get your next sample taken. So that would be your postprandial plasma glucose. Postprandial blood sugar, it's called PPBS. Okay, so that's item number 2. And item number 3 is your HbA1c, which is to be done once in 2 to 3 months. We will do an episode on HbA1c alone because it's a very important concept and I'm sure you'll find it interesting. Yeah, thanks for watching.